Okay, sharing my screen. There we go. There we go. Here we go. Okay, let's talk about cancer. Start out with a video here that describes cancer really well. So I highly encourage you to download the slides once again and watch this video. I think we've also put it in the embedded videos, but I know for sure that it'll play if you download this slide bank. So um, when we talk about cancer, it was just abnormal tissues. We call it a neoplasm. They can either be benign or malignant. So the benign means they're not cancerous, they're not spreading. Malignant means they're going to spread. Metastasize is the spreading of that cancer to other organs. And basically what's happening is the DNA is not replicating well, right? So you're getting a non-functioning cell, which is fine because it's there, but it's not fine because it's not doing anything. So we don't want non-functioning cells. Typically, our bodies handle these things pretty well, and so we don't develop a cancer. But at times, it gets out of control, and it can get larger and larger, and these cells then become a tumor. So who gets cancer? Well, cancer is the second leading cause of death in the U.S. So it's about one in every 4 people are dying from cancer. Pretty common causes are smoking, poor diet, which increases your chance for obesity and diabetes, and then of course sun exposure. Because when we talk about sun exposure, boy, we're talking about skin cancer, and skin cancer is really prevalent. We don't typically die from skin cancer, but we can get it pretty easily. Genetics has something to do with it too. So when we look at the statistics in the second to last 2 and 3rd slide have some statistics for you, so you can see fairly current statistics on what new cancers are coming out or what new cases, and then of course how many deaths from cancer as well. So that's the end of the slide bank. We'll hit those at the end. Poverty seems to be socioeconomics, or poverty tends to be a big factor here, just because of diet. There tends to be more smoking, less healthcare opportunities, and the treatment's not as good. So that's a big problem. African Americans have the highest death rate of cancer, followed by white, Hispanic, Asian, and American Indian. So white women have the highest incidence of cancer. It's breast cancer, but more Black women die from it. So those are 2 interesting statistics. So when you look at that, they don't differentiate it a lot in cancer. It's just cancer in bodies. But when you look at it and broken down in ethnicity, then you'll see that there are some differences. Why does it happen? Well, spontaneous error is one, and that happens quite a bit, but they don't necessarily become a tumor. Some external agent causes the mutation of the cell. X-ray has something to do with that. Other chemical agents are out there. There's cancer-causing genes that lie dormant in our body called oncogenes. And so stress or certain factors maybe outside of our control cause that, like age. It can cause those releases, and we can develop cancer from that. So we basically get old. So that's what that happens. So there's a lot that we can do, and there's a lot that we can't do about cancer. But the fact is that we all are probably going to get a cancer at one point. We may not even know it. So especially the older we get, especially if you're male, prostate cancer is really, really prevalent in men over 60. So just a matter of time in some cases. I don't mean to be a downer, but it's one of the things we live with. So do the best you can, obviously, using the things that we've taught in this class and learned in this class, controlling your stress and not smoking and not drinking and eating well and exercise, and being overall a healthy person will help reduce those factors. Once again, just talked about this, right? So there's internal, external factors that can cause this. We can control some of them, some we can't. So just do the best you can and try to live a healthy life. There are 2 ways that we can look at it: lifetime risk and relative risk. So lifetime risk is the probability of developing a cancer and dying from it. That's a lifetime risk. And relative risk measures the strength of the relationship between a risk factor and a type of cancer. So there's a lifetime risk for smoking and cancer, right? So you have a high probability of developing lung cancer if you smoke, right? So there is a strong relative risk for smoking and lung cancer. So you see how that works? There you go. Smoking happens to be probably the greatest risk factor. So that's why I use that as an example. There are others. So, and we'll look at them when we look over the individual cancers. Some of them are like strong relative risk, but there is a relative risk there. So just, once again, proper nutrition, controlling your weight, exercising, controlling your stress, trying to live a good life is really going to help a lot. Certainly biological factors. There are some cancers that are genetically linked and some that are not. There can be, once again, it just depends. So for example, prostate cancer, if your brother or your father has prostate cancer, there's a high probability that you will have it too. You'll get it too. If they don't, then, there's less. So there's some of those things as well. There's genetic markers for breast cancer and for uterine cancer. So your family members have it, your mom or your grandmother have it, then there's a good chance you will too. There might be a genetic marker there. Certainly occupational environmental hazards. Matter of fact, once again, with prostate cancer, firefighters, for some reason, in some cases, tend to have a higher incident, a higher probability getting prostate cancer. They don't understand why, but it's one of the facts out there. So it just depends on where you work. And there's lots of ways that people protect themselves from it. So X-ray techs, they'll go to another room when they shoot an X-ray, so they're not exposed by X-rays. We do lots to warn people of the dangers and put up signs and things like that. Certainly stress and sleep disturbances have been linked to some cancers as well. So once again, something else that you can be mindful of and try to control. MSG is one of them. Sodium monosodium glutamate is one of them. It's a form of sodium nitrate. It's a preservative. Some pesticides and herbicides, they've done a lot with like whole foods and things like that to try to prevent some of that. Certainly, infectious diseases like HPV can lead to cervical cancer or uterine cancer. There are vaccines for HPV, and here's the thing, it's not just a female problem. Guys, we can carry HPV and not have any symptoms and then pass it on to our partners or partner. If you've had multiple and your wife or your steady hasn't had any, you can pass it along. So HPV is a serious one, and any male or females can get the vaccine for that so that you can prevent that. So that's on cervical cancer. Of course, any cancer of the liver can be stimulated by, let's say, hepatitis, for example, too. So estrogen replacement therapy, there's some conflicting reports on that, although estrogen replacement therapy has some other side effects that they're not doing as much estrogen replacement. It used to be super popular a number of years ago, but it's kind of, I wouldn't say super popular, but it was more popular a number of years ago when women were reaching menopause to do estrogen replacement. There's a reason why your body's wean off of estrogen, I suppose. And there are some complications with it. And one of those is some types of cancer. And in some cases, the treatment for cancer can cause other cancers too. We're getting really good at figuring that out, so that doesn't happen quite as often as it did. Different types of cancer. I'll let you go through these: carcinomas, sarcomas, lymphomas, and leukemias. Some are standalone, like leukemias tend to be just with the blood forming parts, and there's a cancer just for that. Other ones like carcinomas, sarcomas, and lymphomas can be all types of different cancer depending on the layer of the tissue that's involved, the depth and the breadth of the cancer. So all of them pretty serious, some more serious than others. So there you go. You can look over that list, and so you're at least familiar with the terms. This isn't, an oncology class. So just understand that there are different types. So let's get into certain types of cancer. Lung cancer, #1 killer for both men and women. You can have surgery and remove part of the lung, radiation, and chemotherapy to do this. Smoking by far is the biggest contributor to lung cancer, so no smoking. Breast cancer increases with incidence with age. It's the second leading cause of cancer death in women after lung cancer. So breast cancer is the second leading. So there are some ways to detect this early and the better. So self-exams are really, really important, and mammographies, mammograms. So depending on the doctor and how old you are will depend on how often you should get a mammogram. It used to be 40, and then they changed the age to 50. Now they're back to 40 again. So when you hit your 40s, you should get a regular mammogram, depending on your incidence rate. For example, my wife, or prevalence. My wife doesn't have any history of this in her family, so once a year is what the docs are telling her. My mom, on the other hand, has my grandmother, her mom had breast cancer. So my mom, up until she was 70, was getting them twice a year. So there you go. Just depends. Colorectal or colon cancers. This one is considered a common cancer. It occurs quite often. Typically, the warning signs are pretty obvious. You'll have rectal bleeding, bloody stools, things like that. There can be polyps that have formed inside the colon. They're like tissue growths that may not be cancerous, and they'll do a endoscopy or a rectal exam to check those things. It just depends on, or a colonoscopy. They'll go through either direction to see if those polyps, and they'll take samples and biopsy of one and see if it's cancerous. So people over 45 with family history have an increased risk. So they'll either do radiation or they'll do a bowel resection and remove part of the bowel that has those cancerous polyps in it. Pretty preventable if you get to it early. Talked a lot about prostate cancer already. It's the second leading cause of death in men. Usually above 60%, I should say, in cases of 60% of the cases of prostate cancer occur in men over 60. So they are finding that African American and Caribbean men are more likely to be diagnosed, and they don't know why, or most likely to have that diagnosis. They don't know why. Family history is one of the biggest factors, although other factors are under study, like occupation, diet. Obesity doesn't seem to have an effect, and in some cases they have a slower growth of prostate cancer, but their lack of exercise does have an effect. So what my point is that the research is kind of everywhere right now. They're still trying to, research is research. It takes a long time to get a real clear picture. So they're still developing a pretty clear picture. Skin cancer, already mentioned, it's pretty prevalent in the United States, especially here in Arizona, super prevalent because of our sun exposure. If you're fair skinned, blonde hair, blue eyed, if you have light colored hair, green or gray eyes, all those things contribute. It's not just because you have those colors or those, it happens to be, those are signs that your body's ability to protect your skin naturally by getting tan, producing melanin to protect you is lower. So you can use an SPF. Now, if you guys understand, the SPF 30 means that if you take two people and one person doesn't have any sunblock on and another person has SPF 30, then the SPF 30 person is going to take 30 minutes longer to have the same burn than the person without it. So it's just kind of a rating. So you give yourself 30 minutes of protection, basically. SPF 60 gives you 60 minutes and 90 gives you 90 minutes. So you have to reapply if you haven't even gotten wet. Sweat, water, wind, all of that reduces it. So that's what the SPF means. It just is the number, it's the amount of time protection you're going to get. That's how they rate it. So more on skin cancer. If it looks lumpy and bumpy and irregular, go get it checked out. That's as simple as that. 90% of the time they just kind of burn them off. So make sure that if you have something on your skin, you're like, that's new, then go get it checked. No matter how old you are, especially in Arizona, get it checked early. Don't think it's just going to go away. Testicular cancer, I want the guys in the class to look at the age group for risk factor. It's 15 to 35. So realize that most of you are right smack dab in the middle of that risk factor. So once again, self-exams, making sure that the lumps that are there are the normal lumps. So There are lumps in the testicle as it is anyway, but if you that's why regular exams are important. If you're like, well, that's a new lump, then you need to get it checked. Testicular cancer isn't painful. There really isn't any other um, um, symptom other than you have a lump, or eventually your testicle gets very large, it gets swollen, and then you're like, uh-oh, and then it's already there, right? So catch it when it's still a lump. Regular self-exams, especially in this age group, are pretty important. In the shower when it's warm is the best time to do it, and it's just a quick find out if there's any new lumps in there. So kind of get familiar a little bit, not too familiar. All right, ovarian cancer, non-specific symptoms until the late stages as well on this one. Although some risk factors are family history, the older you get, and if you've never been pregnant. Make sure that you're getting regular exams. And once again, this is really important, just as long as that everything is on like its normal cycle. So if things are pretty much normal, then you tend to have, things are normal. So if things start to change, like your menstrual cycles change, things like that, then you might have an issue. So once again, just being aware of your body, I guess, is kind of the point throughout time, right? So things change as you get older. So being aware of those changes is important. Endometrial and uterine cancer. Let me go back because I think this confuses guys, right? So ovarian cancer happens way up in the past the uterus. So if you look on the right here, that's the uterus. I'm circling it with my cursor. The ovary is up here, and this is the uterine tube. Used to be known as the fallopian tube. They've changed the name. They'll probably change it again. And so your ovarian cancer occurs up here. So uterine cancer is then in the uterus, which is here. And that's a little bit different, right? So they treat it differently in some cases. So it's a little easier to detect because you can use, you can get a biopsy of the uterus. It's a little easier to do that. And they just, if you have irregular menstrual cycles or there's pain, things like that. Risk factors, earlier you have intercourse and age. So if you're really young and you have first intercourse or multiple partners, you're increasing your chance for uterine cancer. Cigarette smoking and some STIs or STDs will increase your chance as well. So once again, it's being aware of your body, and bleeding outside of normal menstrual periods and having those other risk factors may indicate that you might have something going on there. Pancreatic cancer is one of the danger ones. These are the ones that if you hear somebody has pancreatic cancer, you kind of relieve because you go pretty quick just because of the nature of the pancreas and what it does. So the pancreas likes to move the stuff that it produces throughout the body pretty quickly, and it does it through the intestine and the lymphatic system. So your pancreas cancers tend to spread really fast, and most people don't survive pancreatic cancer for very long. You can get treated for it if you catch it early. But most people don't. They get fatigued. They have some localized pain. They go to the doctor. They get a check. They run a blood test, and you're like, "Hey, I got pancreatic cancer." And then most of them don't last very long after that. Once the pancreatic cancer is kind of in, stage 2 or 3, it's pretty tough. Leukemia is blood. It's where it occurs in the bone where red blood cells and white blood cells are created, and basically leukemia is malformation of those white blood cells. So white blood cells are they're part of your immune system, and if you don't have that, then you're not fighting off disease, including leukemia. So you have either immature white blood cells, so you've mass-produced immature ones that aren't fighting infection, or you're not producing them at all. It depends on what's happening at the leukemia. So there's Hodgkin's and non-Hodgkin's lymphoma, all kinds of stuff that can contribute to it. I don't mean to muddy the water here, but leukemia can be treated, but it has to be treated pretty quick, and typically it requires a bone marrow transplant in order to get the white blood cells to work again. So what do we do with facing cancer? Well, we've got lots of things that can detect it. Early detection really is the key. So the earlier we can get it, the better. That's really what this slide said. Just try to find it early. Their docs are trying to do less tissue removal than before. They're getting way better at radiation and chemotherapies. They're looking at genetic markers using CRISPR techniques. So they're looking at genetic codes along the RNA strand, so they can actually see where the cancer is, and they're doing some really good stuff with that. So it's getting better and better. still could fund this more if we had more funds, but it's getting better. So here's those slides I was talking about. These are the top 10 cancer rates of new cancer cases. So you can see breast cancer is, and that's 129.7 per 100,000 people. So you just have to do a little bit of math. So we're talking about 1 million people, just do the math, add some zeros. So you can see where they line up though, right? Breast cancer, female breast cancer, prostate, and then here's your lung. So a lot of new cases for breast cancer and prostate cancer, but they tend to be surviving it because lung cancer is still killing more people than any of the other cancers. Then you have colon, and then it works its way down from there. And here's the top 10 cancer deaths by 2019. There isn't any newer statistics, so we're still waiting for some new statistics. So lung cancer right up there at the top, and by a lot. So 33.4 per 100,000 people. And then, of course, breast cancer, prostate, and then we work our way down the list. So, if you're going to fight it, you got to fight it with friends. You need support groups. People, this takes a lot out of the patient, and so they really need a support group. And the families need a support group. So my dad's a cancer survivor, and he does a really good job talking to other people who have gotten cancer and tells them his experiences, and just the sharing of those kind of things helps a lot. So anyway, I hope you got something out of that. And the bottom line is stay healthy. That was this whole class. So if you guys have any questions, please text or email me, and away we go.